Essential minerals for diabetes management. Most diabetics focus on cutting carbs and tracking blood sugar but often overlook minerals that are crucial for insulin function and nerve protection. Deficiencies in key minerals make blood sugar management harder. Magnesium is an essential mineral that plays a critical role in numerous physiological processes, particularly in individuals with diabetes. One of the most significant concerns for diabetics is the loss of magnesium due to high blood sugar levels. When blood sugar remains elevated for extended periods, the kidneys work overtime to eliminate excess glucose through urine, and in the process, vital minerals such as magnesium are also excreted. This mineral depletion creates a vicious cycle, as magnesium is essential for insulin function. Without adequate levels, insulin resistance worsens, leading to further blood sugar imbalances and increased complications related to diabetes. A fundamental function of magnesium is its role in ATP production. ATP, or adenosine triphosphate, is the primary energy molecule of the body. Every cell relies on ATP for proper functioning, including muscle contractions, nerve transmission, and cellular repair. Magnesium is required for the activation of ATP, ensuring that it can be used effectively by the body. When magnesium levels are low, ATP production becomes inefficient, leading to symptoms of chronic fatigue and muscle weakness. Diabetics often experience fatigue as a result of both poor glucose utilization and insufficient magnesium levels, making supplementation and dietary intake crucial for maintaining energy levels. Beyond energy metabolism, magnesium is integral to cardiovascular health. The heart is a muscle that requires constant electrical signaling to maintain its rhythm, and magnesium plays a vital role in stabilizing these electrical impulses. It helps regulate the movement of calcium and potassium into and out of cells, ensuring that heart contractions remain steady and efficient. In diabetics, who are at higher risk of developing cardiovascular diseases such as hypertension and atherosclerosis, magnesium deficiency can be particularly dangerous. Studies have shown that individuals with low magnesium levels are more likely to experience high blood pressure, irregular heartbeats, and increased plaque buildup in arteries. A well-balanced magnesium intake can help counteract these risks by promoting vascular relaxation and reducing inflammation in the cardiovascular system. Nerve health is another crucial area where magnesium exerts its influence. The nervous system depends on precise chemical signaling to transmit information between neurons. Magnesium helps modulate neurotransmitter activity, ensuring that signals are sent and received correctly. When magnesium levels are low, nerve function becomes impaired, leading to symptoms such as tingling, numbness, and heightened sensitivity to pain, common issues in diabetic neuropathy. This condition, characterized by nerve damage due to prolonged high blood sugar, can lead to severe pain, muscle weakness, and even loss of sensation in the extremities. Magnesium acts as a neuroprotective agent by reducing oxidative stress and inflammation, two major contributors to nerve damage in diabetes. Dietary sources of magnesium are diverse and readily available. Pumpkin seeds are among the richest sources, providing high concentrations of magnesium along with other beneficial nutrients such as zinc and omega-3 fatty acids. Spinach is another excellent choice, offering a potent mix of magnesium, iron, and antioxidants that support overall health. Almonds provide not only magnesium but also healthy fats and protein, making them an ideal snack for blood sugar regulation. Dark chocolate, when consumed in moderation, is an enjoyable way to boost magnesium intake while also benefiting from flavonoids that support heart health. Avocados round out the list, delivering a combination of magnesium, potassium, and monounsaturated fats that promote cardiovascular well-being. For those who struggle to obtain enough magnesium from food alone, supplementation may be necessary. Among the most bioavailable forms of magnesium, magnesium glycinate is particularly effective due to its superior absorption and minimal gastrointestinal side effects. This form is often recommended for individuals with sensitive digestive systems who experience discomfort with other magnesium supplements. Thorn magnesium biglycinate is a high-quality option that provides a reliable source of magnesium for those seeking to correct deficiencies. While increasing magnesium intake is beneficial, certain substances can interfere with its absorption and utilization. Processed grains, which have been stripped of their natural nutrient content, contribute little to overall magnesium levels and should be minimized. Sugar exacerbates magnesium loss by increasing insulin demand and promoting kidney excretion of the mineral. Caffeine, although commonly consumed, can act as a diuretic and further deplete magnesium stores. Alcohol also interferes with magnesium balance by impairing absorption and increasing urinary excretion. Additionally, excessive calcium intake can create an imbalance, as high calcium levels may compete with magnesium for absorption, leading to potential deficiencies. Given the intricate relationship between magnesium and diabetes management, it is crucial for individuals with diabetes to be mindful of their magnesium status. A well-balanced diet rich in magnesium-containing foods, coupled with appropriate supplementation when necessary, can provide significant benefits in terms of energy production, heart health, and nerve protection. Addressing magnesium deficiency early can prevent a cascade of metabolic disturbances, ultimately supporting better blood sugar control and reducing the risk of diabetes-related complications. Zinc plays a fundamental role in multiple physiological processes, particularly in individuals managing diabetes. This essential trace mineral is a key component in insulin synthesis and regulation, influencing blood sugar levels and overall metabolic stability. When zinc levels are inadequate, insulin production becomes compromised, leading to increased insulin resistance and poor glucose control. This connection between zinc and insulin function is critical for diabetics, as maintaining optimal zinc levels can help improve insulin sensitivity and reduce fluctuations in blood sugar levels. Research has shown that individuals with type 2 diabetes often exhibit lower zinc levels, making supplementation or dietary improvements essential for long-term metabolic health. Beyond insulin regulation, zinc is indispensable for a strong immune system. Diabetes is known to weaken immune responses, making individuals more susceptible to infections and prolonged recovery periods. Zinc fortifies immune cells, enabling them to function efficiently in combating pathogens. This mineral influences T-cell production, crucial for immune defense, and helps modulate inflammatory responses. For diabetics, who are at an increased risk of infections such as urinary tract infections, respiratory conditions, and slow-healing wounds, sufficient zinc intake can be a protective factor. Zinc deficiency has been linked to increased inflammation, which not only exacerbates diabetic complications but also contributes to the progression of chronic diseases like cardiovascular disorders. Wound healing is another essential function of zinc, making it particularly relevant for diabetics prone to slow recovery from cuts and injuries. Elevated blood sugar levels interfere with the body's ability to repair tissues efficiently, increasing the risk of ulcers and infections. Zinc supports the synthesis of collagen, a critical protein in tissue regeneration, and enhances cellular repair mechanisms. This mineral's role in wound healing is evident in studies demonstrating faster recovery times and reduced risk of infections in individuals with adequate zinc levels. For diabetics struggling with foot ulcers, a common complication of the condition, ensuring sufficient zinc intake can improve healing rates and decrease the likelihood of severe infections that may lead to amputations. Dietary sources of zinc are abundant, but the bioavailability varies depending on food sources. Oysters contain some of the highest concentrations of zinc, making them an excellent natural option for replenishing zinc stores. Beef liver is another potent source, providing high levels of bioavailable zinc along with essential nutrients like vitamin B12 and iron, which further support metabolic health. Pumpkin seeds, often overlooked, are a valuable plant-based source of zinc, making them an ideal choice for vegetarians and vegans looking to maintain adequate levels of this mineral. Grass-fed beef provides another nutrient-rich source, containing not only zinc but also beneficial fatty acids that contribute to heart health. Incorporating these foods into a balanced diet ensures sustained zinc levels, which can be particularly advantageous for individuals managing diabetes. Zinc supplementation is an alternative approach to addressing deficiencies, especially for individuals who struggle to obtain sufficient zinc through diet alone. Zinc picolinate is one of the most bioavailable forms of zinc, meaning it is easily absorbed and utilized by the body. This form is often recommended for individuals with digestive issues or compromised absorption due to chronic conditions like diabetes. Thorne Research Zinc picolinate is a well-regarded supplement that provides a reliable source of this essential mineral. Regular supplementation with bioavailable forms of zinc can help maintain adequate levels and support overall metabolic and immune health. However, certain dietary and lifestyle factors can hinder zinc absorption and contribute to deficiencies. Diets high in sugar and processed foods not only displace nutrient-dense options but also deplete zinc levels, exacerbating deficiencies. Excessive alcohol consumption is another factor that impairs zinc absorption and increases urinary zinc excretion, making it more challenging to maintain optimal levels. Unsoaked grains contain phytates, compounds that bind to zinc and reduce its bioavailability. Traditional food preparation techniques, such as soaking and fermenting grains, can mitigate this effect, enhancing zinc absorption and ensuring the body receives the necessary nutrients. The interplay between zinc and overall health is profound, particularly for individuals with diabetes. Its influence extends beyond blood sugar regulation to immune defense, wound healing, and inflammatory control. By prioritizing zinc-rich foods, incorporating highly bioavailable supplements when needed, and minimizing dietary inhibitors, diabetics can enhance their metabolic health and reduce the risk of complications associated with zinc deficiency. The importance of zinc in diabetes management underscores the need for a holistic approach to nutrition, where nutrient-dense foods and mindful dietary choices play a pivotal role in maintaining long-term well-being. Chromium is a trace mineral that plays a crucial role in insulin function and glucose metabolism. Its significance in the human body extends to various physiological processes, particularly in individuals with diabetes who often experience a deficiency due to excessive loss through urine. This deficiency can exacerbate issues related to blood sugar regulation, leading to fatigue, increased cravings, and metabolic imbalances. Understanding the mechanisms by which chromium influences insulin sensitivity and glucose uptake is essential in recognizing its importance in managing diabetes and overall metabolic health. One of the primary functions of chromium is its role in enhancing insulin action. Insulin, a hormone secreted by the pancreas, is responsible for facilitating glucose uptake into cells, thereby regulating blood sugar levels. Chromium interacts with insulin receptors on the cell surface, increasing their sensitivity and efficiency in transporting glucose from the bloodstream into cells. This process is critical for maintaining stable blood sugar levels and preventing spikes and crashes that can be detrimental to diabetics. Studies suggest that individuals with chromium deficiency exhibit impaired glucose tolerance, which can contribute to insulin resistance and the progression of type 2 diabetes. Glucose metabolism is a fundamental aspect of energy production in the body, and chromium plays a vital role in this process. When dietary carbohydrates are broken down into glucose, insulin aids in shuttling this glucose into cells, where it is either used immediately for energy or stored for future use. Chromium enhances this process by improving the binding of insulin to its receptors, ensuring that glucose is efficiently utilized. In diabetics, where insulin resistance is a common issue, chromium supplementation has been studied for its potential to improve metabolic function and reduce the severity of blood sugar fluctuations. The dietary sources of chromium are diverse, and incorporating chromium-rich foods into one's diet can help maintain optimal levels of this essential mineral. Broccoli is a particularly excellent source, as it not only provides chromium but also contains fiber and antioxidants that support overall metabolic health. Egg yolks are another beneficial source, offering not just chromium but also healthy fats and essential nutrients that contribute to cellular function. Grass-fed beef is known to contain higher levels of chromium compared to conventionally raised beef, making it a superior choice for individuals looking to boost their intake. Brazil nuts, in addition to being rich in selenium, also provide chromium, making them a valuable addition to a balanced diet. Supplementation is often recommended for individuals who struggle to obtain sufficient chromium through diet alone. Chromium picolinate is one of the most commonly used forms due to its high bioavailability, meaning that the body can absorb and utilize it efficiently. Research indicates that chromium picolinate supplementation can improve insulin sensitivity and reduce blood sugar levels in individuals with diabetes. Another effective form is chromium polynicotinate, which is bound to niacin and has been shown to enhance glucose metabolism even further. The choice between these supplements often depends on individual needs and how well the body responds to different forms of chromium. Despite its benefits, several factors can hinder chromium absorption and utilization in the body. Diets high in processed carbohydrates and refined sugars can interfere with chromium levels, as these foods cause rapid spikes in blood sugar that increase chromium excretion through urine. Chronic stress is another factor that depletes chromium levels, as stress hormones like cortisol can alter metabolic processes and lead to increased mineral loss. Alcohol consumption further exacerbates chromium depletion by impairing nutrient absorption in the digestive system. Therefore, reducing the intake of processed foods, managing stress levels, and limiting alcohol consumption are essential strategies for maintaining adequate chromium levels. In conclusion, chromium is a vital mineral for insulin function and glucose metabolism, with significant implications for individuals with diabetes. By improving insulin sensitivity and enhancing glucose uptake, chromium contributes to better blood sugar control and overall metabolic health. Consuming chromium-rich foods such as broccoli, egg yolks, grass-fed beef, and Brazil nuts can help maintain adequate levels, while supplementation with chromium picolinate or chromium polynicotinate may be beneficial for those with deficiencies. However, factors such as processed food consumption, high sugar intake, stress, and alcohol can negatively impact chromium status, making lifestyle and dietary choices crucial in optimizing its benefits. Magnesium, zinc, and chromium are fundamental minerals that play a critical role in managing diabetes, influencing insulin function, nerve health, and metabolic stability. Their presence in the body directly affects how efficiently glucose is processed, how well the nervous system functions, and the extent to which sugar cravings can be controlled. Understanding their significance helps to reveal the depth of their involvement in biochemical reactions and metabolic pathways essential for individuals dealing with diabetes. Magnesium, often overlooked, is indispensable for energy production, cardiovascular function, and nerve integrity. In diabetics, magnesium levels tend to be lower due to its depletion through excessive urination associated with high blood sugar. This loss contributes to insulin resistance, where cells become less responsive to insulin's ability to transport glucose. As insulin resistance worsens, blood sugar remains elevated, creating a cycle that further depletes magnesium. The role of magnesium extends to ATP production, as ATP, adenosine triphosphate, is the energy currency of the body and must bind to magnesium to become biologically active. This connection underlines why magnesium deficiency results in fatigue and muscle weakness, two common complaints among diabetics. The heart, being a muscle that requires vast amounts of energy, is especially vulnerable to magnesium deficiency. Magnesium helps regulate heart rhythms and prevent arrhythmias, which can be a severe complication in diabetic patients who are already at risk of cardiovascular disease. The nervous system also relies on magnesium to prevent neuropathy, a condition characterized by pain, tingling, and numbness in the extremities, which many diabetics experience. Incorporating magnesium-rich foods such as pumpkin seeds, spinach, almonds, dark chocolate, and avocados can support optimal levels. Additionally, supplements like magnesium glycinate and thorn magnesium biglycinate are effective in replenishing magnesium stores without causing digestive discomfort, which is a common side effect of other forms such as magnesium oxide. However, factors such as excessive calcium intake, high sugar consumption, caffeine, alcohol, and processed grains deplete magnesium levels, counteracting dietary or supplemental efforts to restore balance. Zinc is another mineral crucial for diabetes management due to its involvement in insulin synthesis, immune defense, and tissue repair. Since diabetics tend to lose zinc at a higher rate through frequent urination, they are at an increased risk of deficiency. Zinc is necessary for insulin production in pancreatic beta cells and contributes to the structural integrity of insulin molecules. Without adequate zinc, insulin secretion becomes impaired, exacerbating blood sugar imbalances. Additionally, zinc plays a role in immune function, making diabetics more vulnerable to infections when levels are low. Wound healing, which is often slow in diabetics, is dependent on zinc's ability to facilitate tissue repair and reduce inflammation. Deficiency in this mineral not only prolongs healing time but also increases susceptibility to ulcers and skin complications. Furthermore, inadequate zinc levels have been linked to heightened sugar cravings, possibly due to the mineral's role in taste perception and appetite regulation. Including zinc-rich foods such as oysters, beef liver, pumpkin seeds, and grass-fed beef can help mitigate these risks. Supplementing with zinc picolinate or thorn research zinc picolinate enhances absorption and effectiveness. However, high-sugar diets, processed foods, alcohol, and unsoaked grains contain anti-nutrients like phytates that bind to zinc, preventing its absorption and further compounding deficiency issues. Chromium, though required in trace amounts, has a profound effect on insulin sensitivity and glucose metabolism. It enhances the action of insulin, allowing cells to take up glucose more efficiently, thus stabilizing blood sugar levels. Diabetics tend to lose chromium through urine, leading to an increased need for dietary or supplemental intake. When chromium levels are low, insulin's ability to regulate blood sugar is diminished, causing higher glucose levels, increased cravings for sweets, and greater fatigue. Chromium is vital in activating insulin receptor sites, which is why its deficiency has been linked to worsening insulin resistance. Without sufficient chromium, glucose remains in the bloodstream rather than being absorbed by cells for energy use, leading to persistent fatigue and a greater risk of diabetes-related complications. Foods such as broccoli, egg yolks, grass-fed beef, and Brazil nuts contain naturally occurring chromium and can support metabolic function. Supplementing with chromium picolinate or chromium polynicotinate is recommended due to their high bioavailability. However, consuming processed carbohydrates, excessive sugar, alcohol, and chronic stress can deplete chromium stores, worsening insulin resistance and metabolic dysfunction. Ensuring adequate intake of magnesium, zinc, and chromium through dietary sources or high-quality supplementation can significantly improve insulin function, stabilize blood sugar, and reduce common diabetes-related symptoms. These minerals collectively contribute to metabolic health, providing essential support for energy production, nerve function, cardiovascular stability, and immune resilience. Diabetics who prioritize maintaining optimal levels of these minerals may experience improved glucose regulation, reduced sugar cravings, enhanced nerve protection, and overall better management of their condition.